Hello, we're back, and we're going to continue our discussion on coding congenital anomalies. And we also have congenital anomalies of the digestive system and the orofacial defects. These are Q35 through Q37 and Q38 through Q45, respectively. These are the things we see commonly: cleft lip, cleft palate. Sometimes we'll see both. And the palate, of course, is a split in the roof of the mouth. The cleft lip is the split that's in the upper lip. And we can have these conditions classified as partial, complete. They can be on both sides, one side, what have you. And pyloric stenosis is basically the obstruction of the pyloric opening of the stomach. And this is from hypertrophy of the circular and longitudinal muscles of the pylorus. And usually the infant eats well from birth until about age 2 to 3 weeks, then vomits and leads to dehydration and the diagnosis. We have genitourinary tracts, Q50 through Q56 and Q60 through 64. And these can be things with the urinary system. These can be the reproductive organs, what have you. Right? We can also have the epispadis, is the defect of the urethra, or the hypospadias, the abnormal urethral opening that requires surgery. And again, more of these types of things, the obstructive genital urinary defects, what have you. And again, important thing is to go to the correct main term. Some of these have names, some of them do not. Whatever the condition is, you can find that in the tabular. And then we also have cystic or polycystic kidney disease. And this is when the kidney looks almost like a bunch of grapes, and instead of filtering the blood, producing urine, you have reduced kidney function. We have a wide range of musculoskeletal defects. This could be the club foot, the different types, the varus deformities where the foot's turning in, the valgus where the foot's turning out. We have the increased arch of the foot. We have the club foot. We have all these different types of things. Usually they're very well documented, fairly straightforward to code, and they fall in codes Q65 through Q70. And now we get into the chromosomal defects, Q90 through Q99. And these are defects that arise from either an abnormal number of chromosomes or defects on specific sections of the chromosome. And each disorder has a characteristic pattern of defects that arises, and these can be present along with cardiac congenital defects or other defects as well. Some of the more common ones are Down syndrome. Down syndrome is what happens on Down syndrome is it's a third number 21 chromosome, right? Also known as trisomy 21. And this produces the mental retardation, the malformations of the head and face, and so on. Edwards syndrome, or trisomy 18, is the same type of issue, except instead of being on chromosome 21, it's on chromosome 18. And Patau syndrome, or trisomy 13, is a third number 13 chromosome. Again, the big key here to this chapter is to make sure that you're getting the right main term. Some of these will be eponyms, things like Downs. Some of these things will be syndrome, like hypoplastic heart syndrome. But in all cases, you should be able to find the main term. It may not, you may also be directed to C or C also. I would advise taking those steps, particularly because as we remember, C is mandatory. C also is a suggestion. But since this is new and these things can be a little less than straightforward, I'd strongly advise if it says C or C also to make sure that you take a look at it. That's all I have for you. Please stop by office hours if you have any questions. Bye now.